In this video, I will talk about Liddle syndrome. Liddle syndrome is a renal tubular defect which is autosomal dominant condition. We know that most of the renal tubular defects are autosomal recessive, but Liddle syndrome is autosomal dominant, which is very high for example. In Liddle syndrome, the site of defect is left distal convoluted tubule in the principal cells. In the principal cell, we know in normal physiology that at the basolateral border there is a sodium potassium pump which pumps 3 sodium outside of the cell and takes 2 potassium inside. This creates a gradient that drives sodium from lumen to inside of the cell via epithelial sodium channel. As sodium enters from lumen into the cell, there is a negativity in the lumen. As a result, potassium diffuses from inside of the cell to the lumen. So in Liddle syndrome, the site of defect is this epithelial sodium channel, where there is a gain of function mutation of this epithelial sodium channel occurs. As a result, more and more sodium will enter through this channel. And we know that water follows sodium and hydrogen follows potassium. So the patient with Liddle syndrome will typically present with hypertension due to gain of sodium and water. And as potassium and hydrogen is lost, due to loss of hydrogen, there will be alkalosis. So we will find metabolic alkalosis with hypertension in this patient. So this hypertension will create the negative feedback to the RAS system. As a result, the renin and aldosterone will be low. And this is very high, for example. And we know that due to high renin and high aldosterone, hypertension is produced. But in case of Liddle syndrome, we will find low renin and low aldosterone but hypertension. So we can say that in Liddle syndrome, we will typically see the low renin high aldosterone hypertension, low renin hypertension. That is very high, for example. For management of this patient, we have to inhibit this epithelial sodium channel. And the drug that particularly inhibits this epithelial sodium channel is amiloride. We know that spironolactone acts by inhibiting the aldosterone, but this amiloride typically inhibits the epithelial sodium channel.